Hi, this is Mike Gerali, and I'm with Shannon Dow, my partner today, and we're here to talk about a healthcare money plan for those of you who are still working.
Yes. So if you've watched any of our other videos, you know that here at Healthcare Genius, we believe that it's so important to protect yourself, not only while you're planning for retirement and costs in retirement, but also while you're working. And in creating this healthcare money plan, it's kind of a two-pronged thing. And the first piece is to make sure that while you're still working, if anything happens, your plans are not derailed, your finances aren't a mess, you don't have to sell your house to pay your medical bills. So today we're going to talk a little bit about why things like HSAs aren't enough, why sometimes health insurance isn't enough, and what the different risks are of not planning properly for a possible catastrophic healthcare event.
Shannon, first of all, I have a question for you. Do you know what a camel's hump is made of or what it's for?
Water? I don't know.
That's what I thought. As a kid, I think we always thought camel humps were made out of water. They're actually energy storage. It's an energy storage fats for a camel who's crossing the desert. So it's designed to provide nutrition and resources when you're having to go across a desert where you may not find anything for a week, 2 weeks, or a month when it comes to water or food. Well, that's kind of the same thing here when we were thinking of our healthcare money plan. We want to create plans for people that can help them get through those tough times if they have a catastrophic health event.
I think when people are thinking about their risks as it relates to a healthcare event, your average person has health insurance, which is great, but unfortunately, health insurance isn't always enough. And why is that, Michael?
Well, we have a lot of, obviously, if you've watched our videos, I've been doing this for the last 30 years and working with companies and their employees on their benefits. And we find that even companies that have some of the richest health plans where maybe they have a $3,000 out of pocket or a $4,000 out of pocket cost, that isn't really the obstacle that most employees face when they get sick. It's the fact that they can't make a living, and they may have short-term disability. They may have paid time off that will cover some of that. But when it comes to short-term disability, and we've talked about this again in a lot of videos, it's only going to pay 60% for most people of their wages. And even then, there are caps. Some of the richest benefits cap out at $2,000 a week. So for those higher income earners, they're going to be left without a significant portion of their salary when you take into account that 60%. Right. So I think that's one of the big areas. And then, having spouses or family members have to help. Maybe they have to take their job off. Maybe they're traveling to, we've had clients have to go to MD Anderson, and so the spouse is having to travel down there, take time off work. They have expenses at hotels and so forth. So, and then beyond that, we always talk about experimental treatments that traditional insurance may or may not cover. Mm-hmm. So those are a couple of areas.
Right. If you take one thing from this video, it should be that health insurance does not cover the inability to work. If you can't work, it doesn't matter what kind of health insurance you have, even if you have the richest plan. You could be in a bind. And again, even disability, so many people don't realize that even if you have disability insurance, it does not cover 100% of your income. So in those cases, it can be really tough for people, even people who were making a lot of money and did a great job of savings. Even if you've got money in the bank, the last thing you want to do is, pay away your savings because you couldn't work for 6 months. Right?
That's right. And raid your 401k or take dollars out of assets that are going to be taxable to you. So when we create a plan for people who are working, we're really looking at what are their obligations. So how, what does their budget look like? How can we protect them? Again, if something happens, what does their disability look like if they have it, if they don't have it? How do we offset that with some other options in their planning? Mm-hmm. And then that experimental treatment, we actually have a master class where we talk a lot about that. We've had clients who've had different types of cancer that treatment wasn't covered. So we look at some of the options out there to help offset experimental treatment, a lot of times with some sort of a life insurance or a critical illness policy that can help pay for those.
Yep. So again, if there's anything that you should take away from this video, it's that you do need to do the proper planning in case of a healthcare event between now and the time that you retire. The healthcare money plan, or the HUMP plan, takes a number of different things into account. It's going to look a little bit different for everybody, but if it's something that you are ready to learn more about and you want to know what your options are, feel free to apply to become our client, which you can do in the description below this video. I think you might have to hit a see more button, but then you can see where you can apply to become our client. And if you're looking for more information, we have a lot of content on this channel, so make sure that you subscribe and click the notification bell so you know when we come out with new videos. And stay tuned for more videos that are specifically about this healthcare money plan.
Stay safe, everyone.
Yes.